When we think of health and wellness, our minds often gravitate toward the big players like exercise, fruits, and vegetables. But lurking beneath the surface is something often overlooked: saturated fat. For decades, we've heard conflicting advice on whether or not it's bad for us. Some experts warn of its dangers, while others claim it's not as harmful as once thought. But what if your doctor isn't telling you the whole story? Let's delve into the hidden dangers of saturated fat and explore what you might not know about its effects on your health. What is saturated fat? Saturated fat is a type of fat found in animal products like meat, cheese, butter, and other dairy products, as well as some plant-based oils like coconut and palm oil. Unlike unsaturated fats, which can be beneficial for your heart health, saturated fats are typically solid at room temperature. These fats are known for raising LDL, low-density lipoprotein cholesterol levels, often referred to as bad cholesterol, which can contribute to the development of heart disease. But that's just the beginning. Saturated fat might have more hidden risks than you realize. The overlooked health risks. Cardiovascular disease. You may already know that saturated fats are linked to heart disease, but the extent of the risk might surprise you. Saturated fat not only raises bad cholesterol levels, but it can also increase inflammation in the blood vessels. Chronic inflammation plays a critical role in the development of atherosclerosis, narrowing of the arteries, which is a major precursor to heart attacks and strokes. While many doctors focus on cholesterol, the inflammatory aspect of saturated fat is often under-discussed. Cognitive decline. Emerging research suggests that saturated fat could impact your brain health. Diets high in saturated fats have been associated with an increased risk of cognitive decline, dementia, and even Alzheimer's disease. The link lies in the role that saturated fat plays in damaging blood vessels and impairing blood flow to the brain, making it harder for your brain to function at its best over time. If you value your cognitive health as you age, reducing your intake of saturated fat could be critical. Gut health. Saturated fats don't just affect your heart and brain, they can also wreak havoc on your gut. A diet high in saturated fats may disrupt the delicate balance of gut bacteria, leading to an overgrowth of harmful bacteria and a reduction in beneficial bacteria. This imbalance, known as dysbiosis, is linked to conditions like obesity, metabolic syndrome, and inflammatory bowel disease. Your gut health is crucial for your overall well-being, and saturated fat might be working against it. Increased cancer risk. While the evidence is still emerging, some studies suggest that a diet high in saturated fat could be linked to an increased risk of certain cancers, particularly breast and colon cancer. Saturated fat can promote inflammation, oxidative stress, and the proliferation of cancer cells, all of which contribute to the development and progression of cancer. Cutting back on saturated fat could be an essential step in reducing your cancer risk. Why isn't your doctor telling you this? Doctors play a crucial role in managing your health, but they often have limited time with patients and may focus on more immediate concerns. Additionally, nutrition advice has evolved over the years, and there is still some debate in the medical community about the full impact of saturated fats. However, the growing body of research suggests that the risks are significant and should not be overlooked. In some cases, your doctor may not be as informed about the latest nutritional science as they are about medications and treatments. It's also worth noting that not all doctors specialize in preventive care or nutrition, which can result in a gap in the advice you receive. What can you do? Now that you're aware of the hidden dangers of saturated fat, here are a few steps you can take to protect your health. Limit saturated fat intake. Reduce your consumption of red meat, full-fat dairy products, butter, and other foods high in saturated fat. Opt for leaner protein sources like poultry, fish, and plant-based options like beans and legumes. Choose healthy fats. Replace saturated fats with healthier fats like monounsaturated and polyunsaturated fats found in olive oil, nuts, seeds, and fatty fish. These fats can help improve your cholesterol levels and reduce inflammation. Focus on whole foods. A diet rich in whole grains, fruits, vegetables, and healthy fats can provide the nutrients your body needs while minimizing the risks associated with saturated fats. Stay informed. Keep up with the latest research on nutrition and health. Your body is your responsibility, and staying educated can help you make better decisions for your long-term well-being. Final thoughts. Saturated fat has been a controversial topic in the world of nutrition for years, but the evidence against it continues to mount. While your doctor might not always highlight the hidden dangers, being aware of the potential risks can empower you to take control of your health. By making small but significant changes to your diet, you can reduce your risk of heart disease, cognitive decline, gut issues, and even cancer. Remember, your health is in your hands. Take the time to review your diet and consider the long-term effects of the choices you make. The dangers of saturated fat might be hidden, but with the right knowledge, they don't have to be a threat to your health.